Tips for talking to youth who are under stress. Welcome. This presentation was developed for first responders, police, youth workers, and others to provide some tips for the de-escalation of situations involving youth exhibiting challenging behaviors. In a stressful or crisis situation, youth may be unable to manage their stress. Some of those youth may have disabilities that increase the likelihood of their inability to manage behavior when under stress. Those of you who encounter youth under stress as part of your job are already aware that there is no response or method that works 100% of the time to decrease unwanted behavior in youth. We hope that you will find the tips suggested in this presentation to be useful to you in de-escalating unwanted behavior of youth under stress. What is stress? Stress is not easy to define. Early research about stress by a psychologist, Hans Selye, attempted to define it as the result of our inability to cope with the demands of our environment. More recent research has identified stress as anxiety. In a 2014 article about coping with stress, the Center for Disease Control and Prevention defined stress as a condition characterized by symptoms of physical or emotional tension. No matter what definition we use, all of us have had stressful situations that could have escalated quickly to an unwanted response or behavior without warning. Children and youth often have more challenges regulating their response to stressful situations and need more help. To better understand stress and provide support for youth under stress, it is helpful to understand how stress can look and why it occurs. When does reaction to stress become a problem for youth? When stress is severe enough, it can overwhelm a youth, leading to unhealthy and challenging behaviors. Some of you may have dealt with youth where stressful events trigger strong emotions that make them feel fearful, depressed, jittery, or sabotage their confidence. Sometimes feelings of helplessness that may accompany stress for youth can lead to a fight or flight response. These challenging behaviors can quickly disrupt everyday life activities, not just for the youth experiencing the stress, but for others around them. When this level of intensity becomes a problem, it needs immediate attention. Manifestations of stress in youth. For youth, stress can be manifested in a variety of ways, including anger, irritability, difficulty concentrating, crying, disruptive behavior, refusal to cooperate, and inappropriate verbal responses. Of course, there may be other unwanted or inappropriate behaviors exhibited by youth under stress, and some of those, like self-injurious behaviors and substance abuse, may involve their physical safety. Some behaviors, like throwing, pushing, and fighting, may also impact the safety of those around them. These challenging behaviors can cause disruption at home, at school, and in the community, leading to situations that need immediate support. I imagine most of you have encountered youth under these conditions. Youth and stress. Not all youth have the skills needed to manage their own stress-related behavior. They may not even be aware of what is causing them stress, and all they can identify is that they are uncomfortable in the situation and feel the need to do something about it. Youth with disabilities may have even more difficulty in managing their stress. For example, a youth who struggles with executive functioning issues, such as attention deficit hyperactivity disorder, may not have the ability to plan and organize a calm way to handle a stressful situation. As a result, an impulsive response to a stressor may result in a negative behavior like swearing. Or a youth with a verbal processing disorder may need extra time to understand what is happening and is not able to respond to a stressful situation right away. As a result, their stress level may increase, and the response might turn out to be a fight or flight response. Or a youth with an anxiety disorder, one of the most prevalent mental health disorders in childhood, often experience a fear response where their brain actually produces a psychological response that keeps them from calming down. As a result, this fear may turn into agitation, disruptive behavior, or even a panic attack. When youth do not have the skills to manage their feelings, they become frustrated and generally have problems following rules. As a result, they may have negative interactions at school and be suspended, get into trouble in the community, cause problems at home that lead to difficult family dynamics, and even run away or have police interaction. 5 tips for responding to youth under stress. First responders, police, and community youth workers who encounter youth in stressful situations may not have much, if any, information ahead of time about that youth's challenges or skill level in managing stress. But when you are in a situation that requires a de-escalation of behavior for a youth under stress, there are some specific things that can be done to help you respond in a less reactive way. First, reassure the youth that you are there to help them. It is important to remember that a youth under stress is feeling the need to control the situation. For example, a youth who feels threatened may use aggressive behavior or a threatening body posture in an attempt to be in charge. Taking over, unless they are causing bodily harm to themselves or others, takes that control away from the youth and can trigger an even bigger response. Remember that you are there to help them regain control. To keep from escalating the situation, first reassure the youth that you are there to help them stay safe. Stay calm and positive. Use a soothing voice and a calm demeanor. Make statements such as, "I hear what you are saying," or "I know you are going through a hard time. You'll get through this." Don't be threatening or challenging, and keep yourself from engaging in angry or intimidating behavior in response to the youth. Body language also sends signals. Take a firm but non-threatening stance. Sometimes being shoulder to shoulder instead of face to face is less threatening. Listening is another good way to help a youth under stress. This is not a good time to try to convince them to do something different unless they are having unsafe behavior. Your verbal engagement in response to agitated behavior may actually make the behavior more intense. Be non-judgmental. Acknowledge that you hear and understand what the youth is saying by mirroring the youth's statements. Again, be mindful that your facial expressions and body posture may send an unintended message to the youth. Keep your distance and allow the youth some space. Speak in a soft and measured voice. Be proactive, not reactive. Offering real-time support to the youth can lead to immediate stress relief. Tell him or her calmly what you want them to do, not what they are doing wrong. Provide them with choices. If you have knowledge that the youth may have challenges managing stress due to their disability needs, remind them what they can do to keep calm themselves, like take a walk, get a drink of water, or go to a quiet place. Because the manifestation of stress is so unique to each person, it is important to be flexible in your response. Offering some kind of immediate support can help to decrease the feelings of stress and de-escalate unwanted behavior. Being non-judgmental, staying positive and calm, and just being there are good strategies to use in these cases. Skills needed by youth to manage their stress. There are specific skills needed in order for youth to deal with stress. Youth who do not have these skills will struggle with self-regulation. Youth who have a disability that impacts their language processing skills and emotional regulation are more likely to have challenging behaviors under stress that can escalate the situation. Some of these skills can be taught at school through regular education classes and social skills curriculum. Some youth are in a special education program, and their individualized education program may have instructional goals aimed at teaching skills for handling stress. At home, parents can access parent education classes, mental health providers, and other trained behavior intervention specialists to help their youth learn skills needed for stress management. Youth workers in community-based settings may also help reinforce these skills being learned by talking with parents about how to help their child manage their feelings and finding ways to replicate what works. It is also important to remember that while these skills can be taught, maturity and disability often impact successful outcome. Case study. What would you do? Tim, who has attention deficit hyperactivity disorder, is trying out for his second year of hockey in the community recreation program. Last year he got into so many fights during games that his playing time was actually decreased. This year, Tim is placed on a lower level team. As his coaches assemble the teams, Tim refused to join his new team and skated to the higher level team, complaining about the tryouts. The coach asked him to go to his new team. Swearing out loud, Tim reluctantly skates to the assigned team and continues to talk about how unfair the tryouts are, disrupting the team meeting. The coach asks him to leave the ice, but instead, Tim throws his gloves and hockey stick at the coach and skates up to him with clenched fists. It's not always easy to come up with a quick response to challenging behavior, but knowing that Tim has a history of being impulsive and can get out of control may help his coach with a plan to help Tim during this type of situation. First, we know that Tim has ADHD, attention deficit hyperactivity disorder, and struggles with emotional regulation, especially in high-stakes situations. Knowing that Tim may be upset about being on the lower-level team, the coach could have pulled him aside during a calmer time and before the teams were announced to assure Tim he is a good player, but needs to be more controlled this year and wants to work with him on that goal. Being calm, positive, and reassuring is a good first step to preventing a potentially stressful situation. Listening is equally valuable. Tim may be able to say how hard he worked and how unfair he thinks the tryout process really is. This is not a good time to argue with him or convince him he is wrong. Just listening and being non-judgmental is best. An active listener lets the person say what they need without trying to stop them, and then paraphrases what they are hearing in a matter-of-fact way. Offering an alternative or a way out of the disruptive behavior could also help to de-escalate the situation. If, despite attempts to prepare Tim for handling his disappointment, he still escalates, focus on helping him find a way out. Asking him to get the water bottles or some other equipment and then join his group may be a good alternative to just having him join the group right away. Because Tim is so upset, going back to his peers right away may not be the best decision. Being proactive, offering support for immediate relief, and being non-judgmental may be the best way to head off unwanted behavior or an escalation of undesirable behavior. In summary, we all have honorable intentions working with youth, and research verifies for us that youth with disabilities are more vulnerable to triggers that contribute to challenging behaviors. While there is no magic bullet to prevent stress, developing a relationship with a youth who has the potential for challenging behaviors will be helpful for that in-the-moment response. Try the 5 steps we discussed to guide your response and be patient with the process. Youth want to know that they are being heard and understood, and that takes time. Youth also want to be safe, and when they are unsafe to others, they are feeling out of control themselves. Having a trusted adult or someone to provide them with that support may be a relief. Finally, knowing when to get help is essential. If your efforts at de-escalation are unsuccessful, take action to keep the situation under control. Having a plan in place for these crisis moments will help prevent an overreaction, although safety should never be compromised. For more help or information on challenging behaviors, please contact Pacer Center. Thank you.